Hi friends, myself Dr. Ayush. So we continue our revision series for the upcoming Fmge exams. So in last video we had discussed four important topics with respect to esophageal motility disorders, battle sign, air underneath the diaphragm and calcified axis. Those who have missed on the video can still have a look at the official YouTube channel of Global Academy of Medical Science where this video is available for free. Now in this video today we shall be discussing another four important questions from your benign breast disorders which have been quite frequently asked. So let's begin our discussion for today. Now these images have been taken from the textbook of Bailey and Love 27th edition. So your first question that I would like to begin with is identifying the procedure. As most of you must have identified by now, this is nothing but a core biopsy procedure, right, which is being done from the breast. So what important points to remember over here is that it is a part of the triple assessment. Now this triple assessment itself is a very important question or a topic because there have been around 2 to 3 questions which have been asked in your last and your recent exam. So this triple assessment includes your history and clinical examination. It includes your radiological examination, then it includes your histopathological examination. Remember that for histopathological examination is rather your confirmatory examination, and nowadays core biopsy is the standard. So what do we get by doing a core biopsy? We get the HPE, which is your histopathological examination, and immunohistochemistry, from which we can get your ER, PR, HER2/neu, which basically forms the basis of molecular classification, right? So in this radiological examination, there is another standard of reporting which is known as the BI-RADS scoring. So BI-RADS scoring is breast imaging reporting data system, right? So it is a score from 0 to 6, where 0 stands for incomplete, 1 for negative, 2 for benign, 3 for probably benign, 4 for suspicious of malignancy, 5 for highly suspicious of malignancy, and 6 for biopsy-proven malignancy. Now, one of your recent exam had a direct question of regarding which of the following does class 2 signify, right? And then, as I had discussed prior regarding the molecular classification of the breast cancer, so we have the following molecular classification of the breast cancer, which includes luminal A, luminal B, HER2 enriched, and triple negative breast cancer, which are done on the basis of ER, PR, HER2/neu, and Ki67 status. Now, so this is an important topic regarding your triple assessment, a very basic topic and a potential point for your MCQs. So do not forget revising this before you appear for your exams. Now the second question over here is usually a very simple question which would be asked to you. This could come as a clinical based scenario or it could be a spot diagnosis. So this is a case of breast abscess, right? So how do you identify this in your clinical scenario? They will usually present with signs of inflammation. The usual signs of inflammation, which include your redness, pain, increased temperature, and swelling. Now an important question and a straightforward question asked over here is most common organism. So which is the most common organism? The most common organism is the Staphylococcus aureus. Right, now comes down to the management part. So when it is in its cellulitic phase, what we need to give is antibiotic. And always remember that if you give antibiotic in presence of pus, what is going to form? An antibioma. Now, prior what we used to do for this abscess was an incision and drainage, but now with the modern technologies, we have gone to USG guided aspiration, which usually suffices for the treatment. Now, if this fails, then you might require surgery. And in surgery, an important question that can be asked is your incision. So, incision that we give is a radial incision. So, this is a very straightforward topic which can be asked. It's basically regarding your breast abscess, right? There you have signs of inflammation. Most common organism is Staphylococcus aureus, usually treated by USG guided aspiration. And if surgery is done in cases of failure of aspiration or where the skin becomes very thin and you need to give an incision, in such cases you need to give a radial incision. Another important point to be remembered over here is that normally the abscess have a fluctuation point, right? Fluctuation sign. Now in case of breast abscess, what happens is the fluctuation sign is usually laid, right? So so this is the radial incision is given, and over here the fluctuation sign is laid. So you do not wait for the fluctuation sign to appear, right? Because the fluctuation sign is often laid. Now another abscess where you find the fluctuation sign developing late is your perianal abscess, right? Now in our next question over here would be the spot diagnosis. So what is this? This is nothing but a Mondo's disease. These are some images which are given in your Bayesian log, and there have been recently many questions being asked from your benign breast disorder, so I have thought of putting up some of the images and discussing over here. So now what is this Mondo's disease? This Mondo's disease is nothing but a thrombophlebitis of superficial veins of breast, anterior chest wall, and it may also be present in arm. So now if you see over here, there is this spot, right, which I make with the dotted line. This is nothing but a thrombosed subcutaneous cord attached to skin, right? So what happens over here is skin over breast is stretched by raising arm. So what happens because of it? To allow, right, a shallow subcutaneous groove to become apparent. So what is the treatment for this procedure? This disease is basically arm movement restriction, right? And it is usually a cell-limiting disease which usually subsides on its own. Usually subsides on its own. So what is this? This is a Mondo's disease, which is thrombophlebitis of superficial veins of breast, anterior chest wall, and may also be present in arm. It is a thrombosubcutaneous cord attached to the skin. The skin over the breast is stretched by the raising arm to allow a shallow subcutaneous groove to become apparent. Now, arm movement restriction, and it usually subsides on its own and does not require in general any major treatment. Now, coming down to the last topic of discussion in this video. So what is the diagnosis for this image? This image is again also taken from Bayesian Love 27th edition. So yes, this is phylloids tumor, right? It is also known as what? Serocystic disease of Brody, right? Also known as serocystic disease of Brody or cystosarcoma phylloid. So in which age group it is common? It is usually seen in women aged 40 years, right? So now you can see over here the ulceration noted in the skin, right? So an important point to be remembered over here is that ulceration in skin is due to the pressure effects, right? So the ulceration in the skin is due to the pressure effect. Now these tumors are usually mobile on chest wall, right? They may metastasize via bloodstream, so may have metastasis via bloodstream. Now these lines are important because they may be asked as a true and false question, or which of the following is correct among all this. So this is where all these lines become important, right? Bloodstream. So now what happens in this radiology, you find a zone of radiolucency, right? So there is a zone of radiolucency around the lesion. Now why this zone of radiolucency occurred? It occurs due to the pressure effect, which is mainly due to the pressure effect, right? And also you find that there are a lot of cystic areas within the solid tumor. Now what is your treatment in this case? Normally the axilla does not require a treatment. It is usually a wide local excision with the 1 to 2 centimeter margin, right? And another topic which I would like to remember you, or rather only a point, is that there is a criteria used in case of phylloid tumor which is used to differentiate it into a benign, borderline or malignant. I'll not go into the details of the criteria, I'll just name you the criteria, which is Azzopardi and Salvadori criteria, right? So this basically differentiates into benign, borderline and malignant phylloid. So let's take a look at the phylloids again. So this image is of phylloid tumor. The skin ulceration is mainly due to the pressure effect, also known as the serocystic disease of Brody, usually present in women aged 40 years. In USG you have an important feature which is a zone of radiolucency around the lesion, which is basically due to the pressure effect, and you would find cystic areas within the solid tumor. The treatment would include your wide local excision with a margin of around 1 to 2 centimeter, and a criteria which I would like you all to remember is the Azzopardi and Salvadori criteria. Now, so we come to end of our discussion. Now in our next series, what I would be doing is that I would be continuing my discussion on important topics from the breast, where I would discuss mainly on the breast cancer and some of the benign conditions and the risk associated with the breast cancer. Now before ending this session, I would like you all to follow this video of nipple discharge, which is again an important topic which can be asked specifically with regard to the management and some of the important causes. So I have uploaded a video which you can find in the Fmge official YouTube channel on nipple discharge. It would be a short video around 8 minutes, where you would be discussed regarding the important causes and the treatment plan, and regarding the tennis racket incision and the cone field excision. And you can keep following the Fmge Telegram channel for free updates, where you can see this 2 updates, where we have started a new series called the surgical anatomy, right? So where we are trying to collaborate your anatomy part with the surgery, so that it helps you not only your surgery but also in your anatomy. And another hashtag which we are running is your knee head list, where we have your straight one-liners and important questions directly from Bailey and Love, which are your potential MCQs. You can get them for free on just following the Fmge Telegram channel. So that's it for the day, and in your next video, again I repeat, we shall be continuing our discussion important questions regarding your benign breast diseases, specifically the diseases and its risk associated with malignancy, and few important questions regarding malignancy. Thank you.